My name is Agnelo Fernandes. I'm a GP in Croydon. I've been a GP for the last 23 years, and I'm jointly leading on developing the clinical commissioning group in Croydon. I think that clinical commissioning led by GPs is important because GPs are clinicians who work on the shop floor of the NHS. They look after patients and their families, often for generations, and are amongst the most trusted of all health professionals. They also deal with patients as whole people from a holistic point of view, and therefore have an idea of what their health needs are and what services are needed. And using that knowledge and experience, they are in a good position working with their other colleagues in the community in terms of GPs and other practices and other professionals to design services that are much more appropriate, better quality and more cost effective. Our priorities in Croydon in terms of clinical commissioning are multiple. First of all, improving the quality and safety of services is paramount, and we've already started doing that with developing clinical quality review groups for acute services, mental health services and services delivered in the community. The second is a prime concern in terms of ensuring that patients get the right care when they have an urgent care need, ensuring that they get the right care first time to see the right professional in the right place. And we've already started doing this in terms of integrating urgent and emergency care whenever patients have that need on a 24/7 basis. And we've already integrated the out-of-hours service with the urgent care service in A&E so that those professionals in the emergency department have more time to look after patients that they need the skills to look after. We've also delivered a number of different service pathway changes which provide better access for patients, higher quality, but also more cost effectiveness and a better patient experience. For example, not only the urgent care side of things, but also gynecology services which are better delivered in the community, ophthalmology services in terms of cataracts being delivered in the community as opposed to hospitals, and we're looking at redesigning a number of other services, urology services for example, looking at diabetes services and improving the responsiveness of a whole range of different pathways. But our biggest priority is in terms of transforming healthcare in Croydon, looking at integrating health and social care. Health in terms of both mental and physical health, but also in terms of social care, and bringing the experience of clinical commissioners as GPs in terms of looking holistically at the needs of the population, so that we can for once develop more joined up services, reducing duplication, reducing waste in the system and making better use of the resources that we've got. The biggest challenges for us in Croydon is reaching financial balance. We unfortunately find ourselves in a deficit position which we're going to inherit from the previous PCT, which means that we need to be much more innovative in the way we do things going forward to be able to reach that financial balance and also bring about some of the transformational changes. And as part of going forward, it's that transition from where we are now to where we want to be with the reforms, which is going to be something that we need to take everyone with us, doctors, nurses, hospitals, and all our stakeholders, as well as the public, in terms of adjusting to a new way of working. And this new way of working is going to be quite different to anything we've seen before. So we're aiming to have transformational change, but we also need to have changes in behaviour and mindsets. We're going to have to do more with less, given that the financial resources are going to be constrained. We are going to need to do things very differently than that we have done before. And so this is going to be a challenge, but it's not a challenge that's insurmountable. And we've already started building some of these, the building blocks to take us forward. As Pathfinders, we have had a vision that is becoming more synonymous with all our partners and within the clinical commissioning group, a vision that is about sustainability of healthcare, a vision that is about redesigning services and not cutting them, a vision that is about improving the quality of care that we provide, and a vision about using innovation to its maximum potential. So the more we share that vision, the more we'll be in a position to go forward in a much more productive way. The second is that we have been able to engage not only our GPs locally and practices, but also our stakeholders in terms of the local authority, in terms of the voluntary sector, and also developing relationships with different groups within Croydon, so they understand what the changes are all about, where we're coming from, how we're doing things differently. And really, it's about how we're going to think about moving forward, building on what we've already done. We're amongst the first in the country to have a truly integrated urgent and emergency care system. Having out of hours, having the urgent care centre in the Croydon University Hospital, having NHS 111, a directory of services, is unique to London certainly, and to other parts of the country. And if we've managed to do this in such a short space of time, then going forward is something we can build on the experience of what we've done with urgent care and other service redesign, so that we maintain this momentum going forward, so that in 2 years' time, when we are in financial balance, we'll be in a much better place, both financially but also in terms of the quality of care that we provide to our patients. As a GP, I've seen more change in the last 6 to 9 months because we have been involved in the commissioning of healthcare in Croydon than I can remember in the last 23 years, which is a really positive position to be in, because it shows that we are making a difference.